The main concern for Marie is the downturns at the corner of the mouth, which a lot of women come here complaining of because they feel it makes them look sad, even when they're not sad. So what we want to do is try and restore the corners of her mouth so that it sits up and looks a little bit more naturally smiley. So the way we're going to do this is using a combined approach. We're going to try and achieve a little bit of lift from above using some filler up here in the cheek, okay? So we're going to fill the lateral part of the cheek, probably also going to put a little bit in the middle section of the cheek, and then we're going to come down and work at the chin. And a couple of issues going on with the chin here. So in Marie's case, the projection of the chin is adequate, so we don't need any more projection, so the chin doesn't need to come out any further. The chin is a little bit short, so we're going to add a little bit of height to the chin under here and here, and loss of vertical dimension to the chin is one of the key changes that happens to the mandible or the jawbone as we age. So this is commonly an issue for women as they get older, the loss of height of the chin, and it causes all sorts of problems in this area. And in Marie's case, it's definitely contributing to the downturn here. So we're going to restore the vertical height to the chin. The labiomental sulcus here is quite deep, so we're going to build this area up. And the combination of giving us some support here and a bit of lift up here is going to help take away the downturn at the corner of the mouth. We probably won't get rid of that completely, but it's going to look a good bit better. All right, do you want to have a wee lie back for me? So we're going to start by augmenting the cheek, and when I'm augmenting the cheek in this situation, I'm going to be injecting the filler into a layer of the face called the SMAS. And the SMAS is sometimes referred to as the muscle layer because it's a fatty layer of tissue below the skin that also contains some of the important muscles of facial expression. So when we expand the SMAS, it helps to lift those muscles and give us lift to the lower part of the face, which is really important for our objective here of elevating the corners of the mouth. Okay. So far we have just done the cheek. You can see that that's already starting to give us a little bit of lift to the corners of the mouth, but most of the work is going to come from supporting the chin and this area in the lower lip here. Okay, so just have a wee. And we're gonna come along under the chin. So here I'm using quite a thick product called Volux, which is designed specifically for augmenting the chin. So this is designed to feel more like bone than soft tissue. We've now done the cheeks on both sides, and we have filled the undersurface of the chin here to restore the vertical proportion on that side. And can you see how the downturn on this side now looks less than the downturn on that side? Okay, so you can see the importance of, although all these things have small impacts, cumulatively, when you add them all together, it's a much bigger impact. But you can see literally how just restoring that height there has already improved the appearance here. You okay? Mm-hmm. So this product that I'm using under here feels quite hard to start off with. It will gradually soften in. It will eventually feel like your own tissue, but it will just feel a wee bit hard to start with. All right. Mm-hmm. So I'm now filling what we call the labiomental sulcus, which is the white part of the lip in here, which again helps to support the lower lip and reduces sagging around the mouth area. See how that's looking good. And then lie back a wee second again, please. So now we've created some really good foundation and structure and lift to support the corner of the mouth, but I'm going to come in directly to the marionette line, which is the line that comes from the corner of the mouth down to the chin, and infiltrate some volume here directly. This used to be the way that all fillers were injected directly into folds, but actually we get much more better and sophisticated results by creating structure first and then doing the minimum amount that we can get away with directly into the fold. One last tiny little bit just at the corner to complete the up tilt. There you go.
Wow. Wow. Oh my goodness. Oh God, I can't believe it feels a bit numb just now, but wow. God, it's all like...
So we've lifted from here, we've restructured under here, and it's just supporting the corners of the mouth so we don't have that downturn anymore.
Gosh. That's amazing. Finally. Thank you very much.
You are very welcome.
That's lovely.
I think it looks pretty fabulous, if I may say so myself.
Yes, you can.